Hi, my name is Dr. Ashlin Alexander. I'm a facial plastic surgeon and hair transplant surgeon in Toronto. I'm here at the Toronto Hair Transplant Centre. I work with my partners, Dr. Jonathan Huber and Dr. Robert Jones. Today we're here to talk about eyebrow transplantation. We've got our lovely patient, Michelle, here today. Like many of our eyebrow transplant patients, Michelle in her younger years did a lot of plucking of the eyebrows, over plucking of the eyebrows, and for many folks those eyebrow hairs just don't grow back. It was fashionable at the time, but now the fashion is to have sort of heavier, thicker, fuller brows. And so we've got more and more patients coming to see us about restoring those eyebrow hairs that were overplucked or lost in the past. Some people will go ahead and tattoo the eyebrows to create that fullness, which is a nice in-between measure, but eventually people prefer to have their own hairs to restore those eyebrows. So a really important part of eyebrow transplantation, of course, is the design of the eyebrows itself. And we always encourage our patients to bring in photos either of what their eyebrows used to look like or social media pictures that are inspirations for them in terms of what kind of eyebrows they hope to have. All right, Michelle, so there's some standard kind of measurements. Head towards me a little bit in terms of what like an ideal eyebrow looks like. So first of all, nobody's eyebrows are totally symmetric, right? Just like nobody's face is totally symmetric. So for you, your right brow sits a little bit lower than the left in the middle, and it arches up a little bit more as you get to the outside. In general, we look at like the inner aspect of the eye, and that's roughly where we want the inner aspect of the eyebrow to line up on the vertical. So yours is not far off. On the left, it's pretty good. On the right, it goes a little bit too far out, so we're going to want to bring that in a little bit, which I think is something you identified as something definitely. You want to do, right?
Yep.
So when we measure that, we would say, okay, we need to bring that in just a little bit. And then, to some degree, we can follow your eyebrow mark or tattoo to say, okay, that's roughly the outline we want to achieve, except that, in certain spots we want to kind of go higher. Now for the outer aspect of the eyebrow, where the tail ends, we go from the edge of the nose through the what's called the lateral canthus, so the edge of the eye, and the end should be somewhere around on that line there. Same thing on this side. So we go through the outer edge of the eye, and it ends on that line there, which is basically where your tattoo ends, and then eyes open. In terms of the arch of the brow, I mean, that's the most important sort of design aspect. There are standard measurements where we go on the outer, from the nose to the outer aspect of the iris, and that point there should kind of be the high point, which again is roughly where, or almost exactly where your tattooing is. But we're going to look at this together and make sure that's exactly where you want it to be. Nowadays, it looks straight at my nose. There was a time when like the ideal eyebrow was one that had a lot of an arch, and that arch was closer to the middle. Now, the way we design things, we want the arch to be a little bit more to the outside edge. And more than anything, eyebrows are becoming more and more flat as opposed to really arched. And that's exactly what you showed me in those pictures, right? So that's what we're going to try to match. So again, we're not trying to make them perfectly symmetric, because that just doesn't exist, but we're trying to get them pretty close. So yeah, so basically we brought the eyebrow in a little bit on the right, we brought it in even more on the left, but when I measure from the middle here, it's a centimeter on either side, so that's symmetric. The starting point on the lower aspect is level, it's level on the upper aspect, and we basically made it a little bit thicker in this sort of half. Same thing here, a little bit above the tattoo, and then kind of tapered it off to the edges, just like we normally would for a natural eyebrow. So we're just about to get started with the surgical aspect of the procedure now. We're going to flip Michelle over, mark out the areas that we want to harvest our grafts from. In her case, we're probably going to harvest somewhere around 300 grafts or so. She probably needs about 250 hairs per side to get the kind of design and density that we're looking for. It's all done under local anesthesia. We just trim the area that we're going to harvest from. She'll be able to flip her hair down afterwards, and no one will ever be able to tell that anything was done, including when she walks out the door. It'll be undetectable that anything was done in that donor area itself. So we finished making all of the sites for the grafts now. If you zoom in, you'll see exactly where we've made all these little tiny incisions where we're going to plant the grafts. We're using a blade that's less than 1 millimeter in width to allow us to make really fine sites to house all of these tiny hairs that we transplant into the area. And if you take a look again closer, you'll see that there's a very distinct pattern to the way those sites are made. So on the upper aspect, they're angling down. On the lower aspect, they're angling up in that herringbone pattern, and we taper it out towards the sides. In the inner aspect here, they've got more of an upward angulation. And when we make the sides, we lay them really, really flat so they really match like a normal eyebrow configuration. So Michelle's done really great, and now comes the fun part where the team comes to plant all of the grafts and she gets to just sit back and relax. So we're now at the planting stage. The team is taking those individual grafts and planting them one by one into the tiny sites that we've made for those grafts so that we can reconstitute these eyebrows. If you're able to zoom in, you'll be able to see that there's very fine forceps that are really delicately grabbing each graft and really gently displacing them without any trauma into each of those tiny little less than 1 millimeter diameter sites. And then we're really careful with the way that we plant those grafts so that the angle and orientation and everything is perfect. So when this is all done, she'll have nice full new eyebrows. We're looking forward to that.
All right, so good morning, Michelle. It's been about a month now, I think, since your eyebrow transplant surgery. How's everything going?
Yeah, it's been great. Actually, the healing process has been super smooth, surprisingly. I've had some procedures before and it hasn't been this easy. So I was pleasantly surprised that I actually had less pain from this than actually having my eyebrows microbladed, which I find wild. I actually, like the sharpness of the microblade was more intense than healing from this. So that was a big plus.
That's good to hear.
Yeah.
How was the swelling and bruising afterwards? Did you find that you got pretty swollen, or did you get any bruising at all?
I was pretty swollen, and then it's funny, the first couple of days I was fine, and then I got a bit swollen again and bruising, and I was just, looking up online, and that was completely normal. So
How long did the bruising last for?
I would say 2 weeks for me, like near the sides, like the temples, but like other than that, no one really knew once I was, the scabs were gone and stuff after 2 weeks. So
that's typically what we tell people, is that the swelling and bruising kind of peaks at around the 2 to 3 day mark. Just like if you roll your ankle, it kind of swells up the most at the 2 to 3 day mark. And then it starts to get better and better after that. Because it's around the eyes, bruising kind of hangs out longer. So it can be up to 2 weeks for it to be gone. But for most people, after a week, you can cover it with makeup and nobody can tell. So that's awesome.
Exactly.
And then you started to notice that some of those transplanted hairs have been shedding, I guess?
Yeah, and I was initially bothered that I might have, done something, but I heard that like you would know if the whole graft was coming out. So that was...
They're very solid within the first, 24 to 48 hours.
Yeah.
And it's normal, whether we're transplanting eyebrows or a scalp or a face, whatever it is, that the hairs naturally shed around the 3 to 4 week mark and then start to grow back at around the 3 to 4 month mark. And then it's a process, it's up until a year before it's 100% sort of fully healed. As we talked about, at that 1 year mark, if we take a look again and we say, okay, well, here's a little area where we might need to add a couple of extra grafts, then we can always do that touch up at that time.
Yeah.
So it sounds like you're right on track.
And I was kind of worried about my hair being shaved, but that was totally fine. I think the first couple of days I was like, oh, this is, can people see this? But honestly, it grew back so fast and like you wouldn't even tell. So I would definitely do this way again. Like if that didn't bother me as much as I thought it initially would have. So
interesting. I didn't realize that it was that you were worried about it.
Yeah, I think it's just like, oh no, well, like, are people gonna see that, my hair's missing? But no, I went to my hairstylist. She's like, you are fine. No one's gonna see this. It's low enough.
Yeah.
Yeah.
Once you put the hair down over top, you can't really tell that anything's done.
Yeah, exactly.
It's nice to do it as that partial shave FUE, just because then you avoid the scar and the stitches and that sort of stuff.
That was more intense to me. I think like this. But it's funny, I talked to a friend and she's like, no, I would do the other way because there's no way I would shave like part of my hair. Like it goes back.
Exactly. Yeah. And then the other nice thing about it is we can be very precise. Like we can pick out the exact hairs that we want to use that match with the eyebrow texture. We can harvest the exact number that you need versus when you do a strip, it's a little bit of like a guesstimate.
What you have. Yeah. And that's a really good point too. Yeah, no, but the healing was great too. I wasn't in any discomfort. I didn't even take anything after.
Right.
That was prescribed. So.
Oh wow, that's perfect.
Yeah, no, I just was like, I'll just take some Tylenol at home, and that was completely fine.
That's pretty typical, actually. Most people don't need any sort of pain medication or anything like that at all.
Yeah.
So in terms of what happens next, I mean, really, it's kind of like just, planting the garden and then waiting for it to grow. So,
Yeah.
we'll check in again at around the 6-month mark and just see how things are going. Sometimes you can get little ingrown hairs, almost like little pimples as the hairs are growing in the transplant hairs.
Definitely have
You
that.
can just pop those. If there's any issues, you let us know. We can bring you in and deal with those. But generally, it's pretty smooth sailing. And then, so we'll check in at the 6-month mark and again at the 1-year mark. And then, based on how things look then, we'll decide if we need to do any touch-ups or anything like that. But, usually you don't need to. And if there's any issues along the way, just let us know.
Awesome. Thank you.
Welcome. My pleasure. All right. Look forward to seeing you again soon.
For sure.
Okay. Bye-bye.
Bye.